Good evening and thanks for joining us. There's an important alert tonight about a disease we usually don't worry too much about, measles. It is highly infectious and it's making a big comeback. There are outbreaks here in Canada and in the United States. It's spreading fast too. For decades, measles was all but eradicated thanks to a vaccine, but these days more and more people are not protected. And as Mike Armstrong reports, that's putting all babies and young children at risk.
Start off.
As preventable diseases go, measles is easy, or at least it's supposed to be. There should be no reason for this warning from the U.S.
We're concerned that already in the first 4 months of the year, we're breaking records.
On both sides of the border, health officials are concerned. The U.S. has had 13 states hit for a total of 129 cases. In Canada, the situation's been even worse. 5 provinces have been hit. In one outbreak alone, in BC's Fraser Valley, there have been 416 cases. Now, there have been frayed nerves in Edmonton this week. An outbreak there is being blamed on a traveler who went through the airport earlier this month. 5 people contracted measles. Health officials are warning everyone to be careful.
Every single measles case that develops is a spark to expose other people.
Measles is one of the most contagious diseases known. It spreads through airborne droplets from sneezing or coughing, or through contact with secretions from someone who's infected or something they've touched. The early signs of measles are a runny nose and fever. As it gets worse, a rash spreads from the face down the body. It can lead to death. Now, it's a disease doctors are having to be trained to look for.
High fever.
Because it was almost wiped out in North America.
Because we're seeing an increase in cases of measles, a lot of younger doctors haven't actually seen the measles.
Now, vaccinations have been extremely effective. Back in the 60s, Canada typically had 300,000 to 400,000 cases per year. Now, it's only fatal in 1 or 2 cases per 1,000, but back then that meant hundreds of children dying in Canada each year. The problem now is vaccination rates have tumbled. They're down as much as 7% in parts of Canada. Not only does that put children who aren't vaccinated at risk, those children also put other kids at risk. This 3-year-old had a liver transplant and can't be vaccinated.
Please think of kids and other people in the community who can't fight things off, and it means the difference between life and death for these little ones, and it's just protection for everybody.
Measles can be a big problem for young infants. One of the cases at the Edmonton airport is a 12-month-old child too young to have been immunized. It could also become a bigger problem for adults. Some haven't had all the boosters they're supposed to be given and could be at risk. Mike Armstrong, Global News, Montreal.
Some celebrities have used their star power to dismiss vaccines as dangerous. They fueled the anti-vaccine movement, and now, just as one vocal opponent has changed her tune, another is speaking out. For about a decade now, former Playboy model and actress Jenny McCarthy blamed her son's autism on the measles, mumps, and rubella vaccine he received as a baby. Now she's softened her stance, saying she doesn't think kids should get multiple vaccines in one visit. And actress Alicia Silverstone is adding her voice in a controversial book on parenthood. She suggests you shouldn't vaccinate your kids because they might never be the same again. There's no medical evidence to back that up. Here's what is recommended by the Public Health Agency of Canada: that the first dose of vaccine be given to infants at 12 months. The second is either at 18 months or 4 to 6 years of age. Canada's vaccination rates are pretty high. Only about 5% of kids under the age of 2 have not received the MMR vaccine.